let's palpate again though and see. Still like right there, right? So I'm just going to go in the middle. Yeah, strong. The other thing I can...
Okay. I can handle it.
Yeah? Okay. Now that looks like a good... I'm in deep enough. I can even kind of thread it a little bit too, right? With the angle.
Last time he did.
Last time I did. And I wasn't intentionally trying to, actually. It's just, you know how sometimes the tissue just like takes the needle in? It may have done that. So this is really basic. You know, probably most of you maybe know this protocol, but maybe you're just going with the standard location, and that's fine. Maybe you're palpating and you're finding that most sensitive area there. That was a good, strong reaction real quick. Now, that was all I did yesterday, right? But I did it on the opposite side. If you don't know this combination, this works wonders. It's so amazingly effective and fast. So what I want to show you now is I have the people in a seated position first. Let me grab another chair. When we're working with lumbar conditions, sometimes people will write me and they say, hey, I can't really get the tongue points to work, and I'll typically ask, are you doing it with movement, if it's a musculoskeletal thing? And sometimes people aren't doing the movements, or maybe not enough movements. So the first exercise that I like to have them do after I've put these needles in is to work with the lower lumbar articulations with the pelvis and the sacrum. And the way we do that is we inhale and we arch the low back forward and just come to a nice straight erect position with the spine, and then exhale and then round your low back out. Inhale, do the same. Exhale, round it out. So we're just going for miniature movements in that area, right? And watch that people don't start moving their neck. Sometimes what people will do is they'll be doing this and they're not really moving. Sometimes because they're locked up and they're tight, they might do that, right? But just correct the way that they're moving and try to get them to isolate that movement in the affected area. Whether you're working with the lumbar area or the neck, don't let people move through other joints. You know, people will often move their femur and their hip when I want them to move the knee. So you need to make sure that they're moving the right area, because so many times they'll move areas thinking that they're moving what I want them to move, but they're moving something else. Okay, so we've done about 10 now. I like to have people do about 10 movements, but it looks like she's already going into a parasympathetic state too from that. And think that way, like how do you get them in that state, right? Okay, now the next movement I like to do, and you don't necessarily need to do them in any particular order. I change the order a bit sometimes based on their ability, is just chair squat. So have them stand up and then sit back down. And these are squats, right, which strengthen the legs, the abdomen, the low back, but they're a lot easier than just doing them in the air because we have the support of the chair. And while you're doing this and teaching it to them, I usually sit right in front of them so that I can see them straight on, but I don't want my back to the camera now. As I'm watching her move, then I'm assessing too, and I'm looking for any imbalances. I'm looking for structural imbalances. A lot of times I haven't done a complete structural assessment. They're in a lot of pain. You know, I'll plug the needles in quick, and then I can continue my assessment as I do the movements with them or as they lay on the table. You know, when people are in a lot of pain, they don't necessarily want to go through a lot of questions, right, for you to figure out what's going on. So, whoop, whoop, whoop. Okay.
I'm really in parasympathetic.
Okay, now just have a seat and just be at ease, be comfortable. You can rest your back. Every 2 exercises, I like to have them just be casual about it. Okay.
It doesn't hurt.
No? The needles don't? Okay. Do you want more?
No.
I don't think we need to. You respond well and fast.
Yeah, and it was perfect response. Perfect.
Good.
This is really nice protocol.
It's really nice what?
Protocol.
Protocol. Yeah. Yeah, it's a great one.
Yeah, it works.
For sure. So, Dr. Tong taught that this would work 80% of the time, and in my clinical experience, it's probably 80% of the time that it quickly releases pain for people. But then in those 20% of the time when it doesn't work, I always thought, well, what group do I go to next, right? And then I started asking these questions and started thinking about the myofascial lines. And I did discover after many years of doing this that it did seem to work best for more acute conditions. And for the chronic conditions, it would provide the pain relief, but the condition would come back faster for, deeper, more difficult chronic conditions. So then I started plugging in the other points and isolating the point groups through group acupuncture. Because if it's a group session, you don't need to do all the needles. And if you're doing balanced method approach and you're putting in all the needles all at once, you don't know what needles are doing what. So for that client that doesn't respond to your first group, you haven't overcommitted to using too many needles too fast. If it works, great, you've got information. If it doesn't work, then you've probably collected more information as you're working with them. You're continuing your assessment, and then you may find, or they may share some additional information. Maybe they say, my PT said I had psoas syndrome, and you talk to them a bit more. Get them out of pain fast, and then continue your assessment. Okay, so another exercise I like to have people do is just circles. And feel your weight shift on your pelvis, on your hip bones. I'm getting a nice full circle. One thing I've found with this is that the rotations can often upset people. Like, I may get someone out of pain and they're feeling better with like the chair squats and the first couple exercises, and then I have them do this, and it's frequent that people will say, oh, ow, yeah, right there, I feel it. So what I tell them then is to shorten the arc of the circle. Let's not make it so big, and don't let people rush into it. And some people want to do what I'm doing. So if you have a lot of mobility like I do, or if you've done these a lot, like, be sure to caution them, don't move too quick, too fast. You were kind of doing that the other day, weren't you? Like, she was racing, ready to go. And then
I was happy.
feeling better. We found some sticky spots though.
Oh yeah.
Okay, so we've done about 10 now, so we can reverse direction.
I did it already.
Did you? Okay. Have them go both. And then slowly with these rotations, they can start to work into a wider arc. As you do these exercises, consider all the different movements that are possible. We could have her do lateral bends here as well. We can have her move from side to side even. Let's try some of those. And just go slow. Don't go that far into it yet. Just
See?
Okay. So, feeling all right? Ready to get up?
Yep.
Okay, so we've done those exercises. Often they're feeling better that quick. And the other thing I like to have them do, and I don't necessarily do this in one particular order, except I do like to have them do those pelvic tilts right from the beginning. I do tend to start with the anterior, posterior pelvic movements. We can do that in a standing position as well. And take a shoulder width stance. And then as you inhale, pull your tailbone up, arch your low back. And then as you exhale, drop your tailbone forward. And then inhale, pull your tailbone back as high as you can. Exhale, let it drop forward and down. Make sure that they're isolating the movement. Sometimes people will like bend their knees a lot and they're like this. And I'm like, no, you're not. move in your pelvis. We want the pelvic movement. So you can correct them while they do that. You can assess. So we did that both in a seated position and a standing position. Okay? And the next thing is just walk back and forth. Just walk freely, easily. Yeah. Yeah, just there and back. Do that a few times. And walk towards me in a line so I can see you walking straight. There you go. Now I'm assessing. I'll often see things that I didn't see before. I'm looking at her feet. I'm seeing if she has any external rotations, internal rotations. Walking is a great way to work out that tension. And just continue to do that a few more times. And then I want to look from the side as well. Okay, let's stop there. And another thing that we can do are hip rotations from here. Again, be careful with these, both the seated rotations and the standing rotations. They do sometimes tend to aggravate people a little bit. So if that happens, again, have them shorten the circle. So we're just going to do hip circles, roundabout, like you got a hula hoop. And then reverse direction if you haven't already. Okay, so that feel good? You have any pain? No? Okay. Excellent. Have another seat then. Let's and just sit easily, casually. So I generally like to spend 5 or 10 minutes with them. That doesn't have to take long when you get quick at this, right? After I do that, and they're feeling better, often, then I'll have them lay down. Now, you do also run into people who maybe they're in the bed, you know, if you're doing house calls, or when I was living here, I would often find people flattened out, like in their bungalows, and they weren't able to come in, and so I would do like bungalow calls. And it's like a house call, but it's much better than a house call in many ways, because you can walk to the bungalow and walk along the beach. And okay, so let's go to the table.